of
one of the
my
first type of
presentation,
cancers that we'll be
and
discussing
basically
is lung
what
cancer.
this
Lung
presentation
cancer,
will entail.
since 1987,
This is to
has
give
been the leading cause
16-year-old Abby
death in
Smith
women,
some
and
brief
it
information on
estimated
one
to
of
have
her
been
relatives who
26%
was
of
recently
female
diagnosed
cancer deaths in
with an
2009.
oral cancer.
Among all the
She's
cancers,
also had other
it's
family members
also
diagnosed
the
with
leading
different types
cause
of
in
cancers.
men too.
My
So
goal is
actually both
basically
men
to
and
give
women.
people a quick overview.
There are two major
And
types
again,
of lung
this
cancer.
is for a 16-year-old.
The
So
first
what
one
I'm doing
being
for Abby is giving her
small
a
cell
brief
lung
presentation
cancer,
of
and then
different
there's
types of
non-small
cancers that
cell lung cancer.
not only her family has been involved in, but millions of others.
So
And
small
what I would
lung
like for
cancer
her
accounts
to
for
be
about
able
10 to
to do
15% of lung
after
cancer.
this video is to be able to discuss
Now,
with her family members
non-small lung
different
cancer
options as
is
far
divided
as
into
what's going on with
the
her family members'
adenocarcinoma,
cancer and also other
squamous
cancers.
cell carcinoma,
So if it
and the
does
large
ever occur
cell
in the future, she
carcinoma
does have a general
categories.
overview. It is a pretty simple video
That being said,
and presentation that I will be giving,
non-small
but again, this is
cell
for
lung
a
carcinoma makes
16-year-old,
up 85
and
to
also
90%
the
of all lung
information,
cancers,
though brief, is easily
which is leads to
attainable.
the
And
next
that's what the goal is here, for her to be
point.
able
Let's
to
start with signs,
talk
symptoms,
to
and
her family
diagnosis.
about this
The signs of
disease,
lung cancer just kind of
this
depends on the
cancer
type of
that
cancer
her
you have
relative
at the
has,
stage.
and be able to
But
make
90% of
appropriate
patients will be
decisions
symptomatic, unfortunately,
with the knowledge she
later on in the
receives. Thank you.
process, basically. And that's common among most cancers. Now, on a later note, we should talk about management. You have a couple options. Three main options would be a surgical resection, chemotherapy, or radiotherapy. There are kind of a bunch of modalities that you can kind of pursue. It just kind of depends. The surgical resection would be preferable, especially if there's a tumor involved. But many lung cancer patients, they're kind of diagnosed later on in the process, and that's no longer an option. And that's when we run into the chemotherapy and radiation therapy as a preferable method of treatment. And you will, of course, decide this with whoever your provider would be. One of the next type of cancers we're going to talk about is breast cancer. And it's a common type of cancer, especially among women. Though men are affected by it, there's a much lower incidence. I guess about 12.7% of female currently born will have breast cancer, which is a pretty significant amount considering it'll happen at some point in their lifetime. And I guess there are some risk factors such as age, family history, and other things along those lines. But a surprising fact to me was the fact that the incidence is a lot higher in Caucasian women. But African women are actually more likely to die from the actual disease. But no matter what, aging is associated with increases of both incidence of death rates when it pertains to breast cancer. Now let's talk about signs and symptoms. Painless or painful lumps in the breast or the underarms. There could be some nipple discharge. There could also be thickening of the actual breast tissue or dimpling of the breast. There could be changes in your breast skin, I guess resembling an orange peel, and that can also occur. The recommended method, I guess, of breast cancer screening would be to start doing it basically when you're over 40, and you would basically go see a provider. And you would go ahead and have the mammogram done. Also, a CT or MRI could be done if indicated. Now, as far as management, there pretty much are different approaches, and you would kind of have to get with your provider. Of course, if you're in a stage 1, stage 2, it's going to be operable versus a stage 3, which means it could actually spread, and you would actually go ahead and pursue other avenues such as chemotherapy, hormone therapy, radiation therapy. And again, this would be discussed with you and your provider depending on the actual stage of your breast cancer. Colorectal cancer, third is the most common cancer diagnosed in men and women in the United States. And if you remember, the first one would be lung cancer. African Americans actually have the highest incidence of this cancer, and then Native Americans, Caucasians, Islanders, and Hispanics follow. Now, there is different types. though the most common type would be the adenocarcinoma, which originates from cells that produce mucus and actually lubricate the gastrointestinal tract. And this is kind of where it kind of manifests. One of the main risk factors would be someone who is over the age of 50. And then, there could also be that family history or gene alteration. So there's a genetic component to these incidences occurring. Now, let's go to signs and symptoms. It can vary depending on where the site of the cancer actually is. And it could be more of an acute presentation, which would mean there would be some type of obstruction within the colon somewhere. There might also be fatigue noticed in your loved one. And then, when they look at their labs, there could be a decrease in hematocrit. And these can all be initial presentations. One of the common tests would be a fecal occult blood test, which is used basically to diagnose how sensitive the blood is in the stool. Now, as far as management, it stands the same. It just kind of depends on the location and what stage it's at. Now, you do still have those 4 different types of treatments: the radiation, chemotherapy, the surgical resection, but you also have something that's called targeted therapies. Testicular cancer will be the next cancer we're going to tackle. It's pretty uncommon, actually, when you compare it to like lung, breast, and colorectal. There's about 8,000 cases, maybe, diagnosed per year. And this is more of a disease process for the young and middle age. Some of the risk factors could be family history, which, has been one of the risk factors for pretty much all these. But also HIV and AIDS. That's a little bit new as far as when it comes to testicular cancer. And this tends to manifest between 20 and 54. And Caucasian men are actually 5 times higher to have and develop testicular cancer of a chance, basically. Next, we'll just talk about the symptoms. You can have a mass enlargement in your actual testicle area. You can have scrotal heaviness, and you can have your groins aching. Those are pretty much all signs. But I guess the diagnosis of testicular cancer is made after a focus in history and physical examination is completed. But you really can't give a for sure diagnosis without tissue samples. So that being said, let's talk about management. You do have a couple of treatment options. Surgical resection. So you can go ahead and have surgical resection done. And you might have to have it done near the lymph nodes, depending on where it's located and how much is actually spread. But if you catch this early enough, surgery alone could totally prevent it. And this is totally curable. So, it's definitely important that if, you find out you do have it, just get it taken care of, because it's really easy to treat. But, radiation therapy is also one of the options that they use. But if caught early enough, simple surgical intervention would be perfect. Prostate cancer is malignancy that basically affects men later on in their years. And I guess the median age diagnosis would be at 72, which is, wow, that's pretty up there. And I guess 1 in 6 men are actually likely to develop prostate cancer in their lifetime, and African Americans have a higher incidence when it comes to prostate cancer. Interesting, though, the exact etiology isn't exactly well known. So they don't really know how it kind of all works and manifests and, affects the body overall. But an inherited DNA change could be a factor in why people actually do wind up with this cancer. And I guess it happens in about 5 to 10% of these prostate cancer patients. So that's pretty interesting. A majority of the prostate cancers develop in the prostate cells, which are actually used to produce fluid, and they're referred to as adenocarcinomas. But one interesting thing to define as far as risk factors is diet, high animal fats, obesity, tobacco use, alcohol, and, benign prostatic hypertrophy, and even STDs. They really don't seem to have any correlation with this cancer. Which is kind of interesting. As far as signs and symptoms, early detection is key. You definitely want to try and detect it as early as you can, but of course, most people diagnose when it's late. And then again, all of the agencies that I actually govern checking for this prostate cancer really don't specify when or how or you should actually go about and how often you should go about screening it. Actually, the ACS actually doesn't even recommend or support routine screening, and this is pretty interesting. And then the PSA doesn't really have any guidelines outlining any screening also. You'll know the disease is present as far as signs and symptoms due to urinary symptoms and also maybe some blood in your urine. These are just some really key indicators that you probably should go ahead and possibly get tested. There are some tests that you can go ahead and do. You can go ahead and do an elevated screening, is what they call it, as far as the PSA organization. You can also do a transrectal ultrasound and then multiple biopsies of the prostate gland. You can go ahead and see exactly what's going on. As far as management, it depends on the stage, the grading of the actual cancer. Pretty much the same, except for this cancer uses something special called a Gleason scoring system, which they kind of use basically to see exactly what stage you're in. And depending on what stage you're in, you can do, the hormone therapy, the chemotherapy, and then there's cryotherapy. So there's different options that you can go ahead and do. But one interesting thing is chemotherapy is actually not recommended as a standard for prostate cancer. They actually would like you to do more of hormone therapy. So that's pretty interesting. One of the next cancers we're going to tackle really quickly is melanoma. This type of cancer that develops within the melanocytes. And these are just your cells that produce melon, basically. As you know, melanoma cancer is deeply pigmented lesions, basically. They can be red, pink, purple, blue, white, and different variations. Interesting, the high sensitive Caucasians, as far as how this disease would occur, pretty much basically the incident would be in Caucasians, and they're 30 times more likely to develop this than African Americans. And again, that just has to do with, African Americans have that darker complexion and their skin will go ahead and reduce the amount of sun exposure. Now, treatment is approximately 1.5 billion annually. Now, that's pretty interesting. As far as warning signs, you need to look for changes in colors of your existing moles, and there can also be bleeding and intense itching. And again, your mole sizes can start varying. That's something you definitely want to look for. As far as diagnosis, it relies on basically the high index of suspicion. There's an ABCDES system basically described by the American Academy of Dermatology, which kind of classifies these signs and symptoms. Though a definitive diagnosis is determined basically by a pathological review of a biopsy, either a punch or excisional. Treatment doesn't really change. It's going to be basically the same as all the others. It depends on the stage and basically where the lesion actually is. So that's not going to change. One of the next cancers we're going to tackle really quickly is melanoma. This type of cancer that develops within the melanocytes. And these are just your cells that produce melon, basically. As you know, melanoma cancer is deeply pigmented lesions, basically. They can be red, pink, purple, blue, white, and different variations. Interesting, the high sensitive Caucasians, as far as how this disease would occur, pretty much basically the incident would be in Caucasians, and they're 30 times more likely to develop this than African Americans. And again, that just has to do with, African Americans have that darker complexion and their skin will go ahead and reduce the amount of sun exposure. Now, treatment is approximately 1.5 billion annually. Now that's pretty interesting. As far as warning signs, you can need to look for changes in colors of your existing moles, and there can also be bleeding and intense itching. And again, your mole sizes can start varying. That's something you definitely want to look for. As far as diagnosis, it relies on basically the high index of suspicion. There's an ABCDES system basically described by the American Academy of Dermatology, which kind of classifies these signs and symptoms. Though a definitive diagnosis is determined basically by a pathological review of a biopsy, either a punch or excisional. Treatment doesn't really change. It's going to be basically the same as all the others. It depends on the stage and basically where the lesion actually is. So that's not going to change. Alrighty, so oral cavity cancers, that we're going to talk about next, and they basically develop in an actual oral cavity, which includes like the lip, the mucosa, the oral tongue, the hard and soft plates, your gums, your mouth, your tonsils, your tonsil pillars. It's kind of interesting. Oral cavity cancer actually contributes to more than 6,000 deaths per year, and it occurs in individuals normally older than 45. One of the risk factors would be, of course, tobacco smoke, chewing tobacco, cigarettes, pipes, smokeless tobacco. But newest research has also shown that HPV has a role in the development of oral cancers, which is pretty interesting. As far as signs and symptoms, it can be detected pretty early. You want to look for changes in whatever dental appliances you're using. Also, you want to look for sores on your lips that don't heal, masses on your lips, and like kind of white or red patches on your tongue. Though a definitive diagnosis really can't be made until there's a biopsy of the suspected tissue. As far as management, still the same, depends on how far it's spread, on the size. If you're like a stage 1 and 2, you're most likely going to be treated with surgery or radiotherapy. But when you get into the 3 and 4 category, you're pretty much going to be looking at surgery, radiation, along with chemotherapy, so a lot more involved.
Of my presentation and basically what this presentation will entail. Um, this is to give 16-year-old Abby Smith some brief information on one of her relatives who was recently diagnosed with an oral cancer. She's also had other family members diagnosed with different types of cancers. My goal is basically to give people a quick overview. And again, this is for a 16-year-old. So what I'm doing for Abby is giving her a brief presentation of different types of cancers that not only her family has been involved in, but millions of others. And what I would like for her to be able to do after this video is to be able to discuss with her family members different options as far as what's going on with her family members' cancer and also other cancers. So if it does ever occur in the future, she does have a general overview. It is a pretty simple video. and presentation that I will be giving. But again, this is for a 16-year-old, and also the information, though brief, is easily retainable. And that's what the goal is here, for her to be able to talk to her family about this disease, this cancer that her relative has, and be able to make appropriate decisions with the knowledge she receives. Thank you.